I am Kathleen Ayers Lanzillotta. I'm the coordinator of the Chemical Dependency Counselor Training Program here at Suffolk County Community College. People don't want to admit that they have anybody in their family with alcoholism or drug dependency. Some people would rather say I'm depressed or I'm seeing a psychiatrist for emotional problems. There's still a very strong stigma attached to addiction. There's outreach efforts that really do work. People are publicly saying, my family or my life has been touched by this illness, and the help is available, and you really can get better. The unfortunate statistic is that the vast majority of people with this illness die from it. The percentage of people that get through the doors of treatment is very small. That's why we need to improve access to care, because most people that are addicted don't recover. Their cause of death might not be addiction. It could be gastrointestinal disorders or a heart failure or other medical illnesses, but it could very often is related to their alcohol and drug consumption. The death on the highways very often is caused because of alcohol and drug disorders. So we have a tough road ahead of us in terms of reaching out and getting the message to society on this one. It's not that simple. Person doesn't have control. It's a progressive illness, and most people that have an addictive disorder don't wake up one day and say, yep, I'm going to become an addict today, that's what I'm going to do. It grows on them, and they gradually lose control. And that control is lost where sometimes they have control and they drink only what they think they're going to drink. I'm going to have 2 drinks tonight, that's all I'm going to have. And then the next night they're out and they're abusing and drinking way more or using more drugs than what they expected to. When they really cross that line of addiction is when they can't predict when they can control it and when they can't control it. That's when the disease is really setting in. Many people that are living with the addiction think that it's their fault, and they blame themselves, or they think that maybe that's something they did. So they need help with that thought process. They need help to recover themselves. They can't cure it, they didn't cause it, and they can't control it. It's the 3 C's. They can't cure it, they can't control it, and they didn't cause it. Sometimes people that are co-dependent, that's what it's called when you're living with somebody with a problem, can have more serious problems and need even more help. I mean, there are degrees. Some people are sicker than others, and we reach out and we help all people. So chemical dependency counselors are trained to work with the whole family. For every one person that's struggling with an addiction problem, it seriously affects the life of 4 other people. That's a statistic, it's a fact. When you multiply that, 1 in 10 people have a problem with addiction. Times 4, that's a lot of people in our community. That's a significant number of people that are affected. If you go into any room and you ask people, how many of you have been touched by somebody in your life that had an addiction problem? 9 times out of 10, at least 1/3 of the people raise their hand and they've known somebody with a problem. And their lives are affected. And the addiction treatment field works with the family. They don't just work with the person who has the addiction problem. They can intervene with any person that's affected by the illness, and that's the primary client. It's not the person who's always the addict that's the first one that comes through the door. With the progression of this illness, people can get off the ladder at any point. You don't have to hit a bottom. Everybody's bottom can be wherever it lands in terms of their self-awareness and their ability to know that it's time for me to start making changes and start to get the help that I need. So it's difficult to identify when the person is at that point. That's where good counseling comes in. Good counselors know how to work with the stages of change, when the person is just thinking about making some changes or when they've really said, I definitely need help. It really is individual. It depends upon the individual and how the counselor works with that person in terms of their stage of change and readiness to make changes. Some people need to have more consequences before they realize that they're ready. The hardest population to work with are people that we call periodic addicts. They may have bouts of when their addictive disorder is full blown, and then their days, weeks, even months can go by where they are what we call functioning addicts and alcoholics. I don't like that word functioning. It's like we're giving people that's okay. It's normal. You're a functioning alcoholic. Well, that's misleading people to think that that's acceptable. But the people that are periodic are very difficult to reach because they don't think they have a problem. And denial is the hallmark symptom of the illness. So it's tough to reach out to this. Many people recover and then they relapse. And another term I'm not comfortable with is relapse is part of recovery. Don't go there. Not good. That gives the message that it's okay to relapse. Well, everybody does it. We don't want to give out that message. But we also do know that relapse does occur, and it's okay for people to come back and get the help that they need to get back on track on the road to recovery. The substance itself isn't the problem. It's the individual and the people in terms of our perceptions of the use and what's acceptable and what's not acceptable. It's not just use, but the abuse, where it gets misuse, where people are starting to use it and not realize that there are problems associated with it. We see hope in the people and in the families who've been through recovery. My family went through recovery. People who are touched by treatment and recovery can give back to other people to help them realize that you can have a life without drugs and alcohol, and there is hope out there. You don't have to keep suffering. You don't have to be part of that statistic of people that are dying from the illness. I think that's the best way to give hope, is through the exposure to other people that have been through it and have grown through it and led wonderful lives as a result of their recovery.